Welcome. I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. Today's video blog will show you how not to be a victim of your doctor or feel like one. It's been all over the news recently. Michigan oncologist Dr. Farid Fata, who gave unnecessary cancer treatments to 533 patients as a money-making scheme, was sentenced last week for his crimes. Dr. Fata's patients were injured, disfigured, disabled, even killed by his brutal and violent behavior, and he's been sentenced now to 45 years behind bars. Dr. Fata, of course, is an exception. The vast majority, let me say that again, the vast majority of doctors are good people who care very deeply about their mission to relieve suffering, and they work hard to give patients the best possible care. Here's the problem. Even the very best doctors work within an imperfect system. Even when our doctors truly want to help us, the medical system can leave us as patients feeling confused, unheard, and powerless. Too often, we feel like victims. What if you could walk out of your doctor's office feeling supported, informed, and in control? You can't single-handedly reinvent the entire healthcare system before your next medical appointment. But by using the 6 steps in this video, you can make your next experience the best it can be. So let's look at the 6 ways not to feel like a victim when you see your doctor. Number 1, get centered. Before your appointment, take a moment to consciously center yourself. Take a few deep, calming breaths. Think of a time that you felt confident and strong. Literally stand tall and picture yourself feeling strong and secure during the appointment you're about to have. Before your appointment and even during your appointment, you can repeat that simple exercise as often as you like. Number 2, choose the right doctor. You want to use both your intellect and your instinct. What is this doctor's reputation? Does she care about getting the little things right, or does she let the details slide? Does she speak respectfully to you? Does she listen to you? Does she answer your questions well? If you don't have confidence in your doctor's judgment, or you don't like the way your doctor treats you, move on and find somebody else. Number 3, write down your questions in advance. When you're sitting on the edge of the exam table, wearing nothing but a paper gown and feeling terrified that something might be wrong with you, is your mind working at your intelligent, logical best? Of course not. When you're in the patient role, it's nearly impossible to think clearly and remember the questions you want to ask. Write down your questions in advance. Over the days or weeks before your appointment, you can keep a notebook handy, make a list in your phone, so you can add a question whenever you think of it. Then bring that to the exam table with you. Right to the exam table. Don't leave it across the room in your pocket or your bag. Number 4, bring a friend. Even better than bringing your list of questions, bring your list of questions and a friend. If you have a friend who works in healthcare, that's great. If not, bring someone along who's confident, calm, supportive, and not afraid to speak up. I have attended medical visits countless times with friends and family members, and it makes a huge difference. Here's what you want to ask your friend to do. Ask questions, lots of questions. Take notes. Try to catch everything. Ask the doctor to explain things again or in more detail if there's anything you don't seem to understand. Your friend should be asking questions, watching you to see if you understand, and asking questions more if you seem confused at all. Most importantly, ask your friend to show you love and support. Number 5, don't rush into treatment. Get information first. True emergencies are rare. Nearly always you'll have plenty of time to gather information before you decide what treatment to choose or whether to choose any treatment at all. Even if it's an hour or a day, usually you have that time. Ask to see your lab results, ask to see your radiology images, and get help understanding them. Get a second opinion. Ask about alternatives, including the alternative of doing nothing or delaying a procedure. And be sure to get the name and the correct spelling of any body part, medical condition, drug, test, or procedure that's being discussed so that you can research it on your own. Number 6, after your visit, call the office if you have questions. After you leave the office, new questions might come up, or maybe you'll remember a question that, in spite of your pre-written question list, you forgot to ask. You don't need to wait for your next appointment. Just call up and ask. In many offices, the receptionist will connect you with a nurse who will either answer your question on the spot or talk with the doctor and get back to you. Many people are hesitant to bother the staff with questions by calling them on the phone, but the job of your doctor and that person's staff is to give you the information you need. Please share this post with others who can benefit from these tips. I wish that I could have personally delivered this information to every single one of Dr. Fata's patients before they became his victims. Even if your doctor is highly skilled as a practitioner and the soul of kindness as a human being, these tips will help you make the most of your medical visits. Responsibility for your health and for your health care rests with you. To get more women's health information that could change your life, click the link below and I'll see you there.